Welcome back to Big Sunday, everyone. The doctor is in the house now, Dr. Drai, an OBGYN who specializes in transgender healthcare, here to give us some tips and some answers from some questions that we've collected from our Facebook and Twitter page. He's helped out a little bit, too. He hails from Pittsburgh, and we're delighted to have Dr. Drai with us. How are you?
Thank you, Frank, for having me.
Nice to meet you, too. Well, let's talk about transgender. Sometimes people don't quite understand. What's it mean exactly? What is transgender?
So I travel around the country all the time giving lectures to doctors about transgender health, or T-Talk is what I call it. And that is one of the most common misconceptions of the transgender population. What exactly is it? So let's go back to two terms, sex and gender. Sex and gender. So sex is what you're born into. If you're a man or a woman when you're born, or something called intersex, which is a funny word for having both male and female parts. Gender expression is how you express yourself. Are you feminine? Are you masculine? Do you think you're a male? Do you think you're a female? So anyone that has a mixed match between sex and gender, then you are transgender. So a lot of people think, a lot of docs think that transgender is like RuPaul's Drag Race, but I like to tell everyone it's like more like Lady Gaga's song, they're just born that way.
Okay, very good. Well, how about you're an OBGYN?
Yes.
What are some of the health concerns that face that population? Male to female, female to male.
So let's go over male to female, female to male. So a trans man is someone that's born a female who's now a man on the inside. A trans woman is someone who was born a male and who's now a female.
Right. So not necessarily went through the whole operation, the whole show.
Correct.
Okay.
Right. So some of the health concerns, like physical abuse, is huge that in this population, as well as suicide, as well as depression, are some of the issues that these people deal with, as well as just mainly discrimination. And also what concerns me, especially for the minority trans population, is HIV. So a lot of these people are discriminated against. They can't get jobs, and then they're homeless, and then some issues with the shelters, because most shelters are ran by religious organizations, and they're kicked out of shelters, and then they get HIV because they're having survival sex. Yeah. Okay. So it's a long list.
Let's put on the OBGYN hat now. Okay. You brought in this question. Got a family history of breast cancer. What is the most important area to check?
So I get this question all the time with my patients. Actually, the best place to check is underneath the arm. So the breast tissue actually goes all the way underneath the armpit. So that's the first place that you need to check. That's the most common.
Like the lymph nodes there?
Yeah,
or?
Right underneath the armpit, yeah. So breast cancer is 1 in 8 in women. So I always tell the ladies, next time you're in a beauty shop, next time you're hanging out with your girlfriends, make sure you quiz them on where they need to check for a breast mass.
Okay. Okay to travel. You're pregnant. It's the holidays. It's crazy. You're shopping, and you're getting on this plane and flying to Pittsburgh.
Absolutely. You should go ahead and travel on a train, on a boat, on a car, on an airplane. Please travel. So I always tell patients, always go on your baby moon before you have your baby, because once the baby's there, you're not going to do anything but take care of the baby.
Right. You got a built-in babysitter.
For the whole year, you're at home, so you might as well just go immediately. But some tips, if you're traveling in a car, you should only go for about 5 to 6 hours in a car. You need to stop frequently, maybe 2 to 4 hours, to actually stretch out your legs, because in pregnancy in general, you have an increased risk of blood clots. So, as well as just being in a car. So they're at a higher risk.
A bathroom break's in order to.
Bathroom break.
Well, they're going to happen anyway.
I know. Trust me.
I know. This one's kind of fun. Advice for women that take bubble baths.
Oh, yeah. Bubble baths are huge. So bubble baths, any bath oils, do not do it at all, because what happens is the vagina actually has good and bad bacteria, and as you know, the vagina is open, so anything that gets in there washes out that good bacteria, and you get this fishy odor. Okay. So that's really bad.
Pap smears. When do you start, and how often as you become an older woman?
So age 21 is when we do pap smears now. Our guidelines have just changed. Women who are age 21 to 29, they should get them every 3 years, and over 30, they should get them about every 3 to 5 years, depending on something called HPV, human papillomavirus. So that virus causes about 70% of cervical cancer. So if they're negative for that, they're low risk of developing cervical cancer.
We're going to keep coming here. Recent study, birth control might be linked to glaucoma. True, false? What's that
true, false. So there was a study that was just published that showed that greater than 10 years of being on birth control, you're at increased risk of glaucoma. That's the first study that's ever shown any findings. So I just told my patients that, so they're really excited to hear.
Okay, and last question, you brought this in, so I'll read it. There's been a lot of headlines about transgender surgeries gone wrong. Are there resources available to find a doctor that certainly knows the situation maybe a little better.
Yes, so there's an organization called WPATH, WPATH, and that's the World Professional Association of Transgender Health. So these professionals are actually trained in trans health. So you just go to WPATH.org and find a provider. I'm actually one of their providers. I'm actually going to Bangkok this year to get some more training in transgender health.
And you've got all kinds of advice on YouTube, too.
DrDrai.com.
Yes.
DrDrai.com. I have medical T videos where I give relatable questions and with real answers from the Dr. Drai standpoint.
And some of the questions are out there a little bit. It's good stuff. You got to check it out. Dr. Drai, happy holidays. Thanks for coming.
Thank you, Frank, for having me.
If you'd like more information about Dr. Drai, you can log on to Dr. Drai, that's DRAI.com, DrDrai.com. Back with more Bay Sunday right after the break. Stay there.